Hello and welcome back to another episode of Elite Medical School. and I'm so fortunate today to be joined by both Dr. I and our good friend here, Dr. P. How are you gentlemen today?
I'm doing great. How are you, Dr. T?
I'm just fiddling with my Winky. So I'm doing okay, thank you. So shall we you know what, we can just jump into things if you'd like. We were hoping today to talk a little bit about the pandemic. No, we're not talking about COVID. We're talking about obesity. So obesity has reached pandemic levels. It's a scourge on our society. And apropos of COVID, I think it's probably the number 2 predictor of mortality and morbidity besides age for COVID. But anyhow, that's an aside. Are you guys excited to talk about overweight and obesity?
I'm excited to talk about this pogdemic.
There's an upside to everything.
I've flirted with obesity most of my life, so it hits close to home.
I mean, I've been in the obese BMI range before, about a few years ago.
Oh, dude, I've always been in the obese BMI range, but I don't really consider the BMI the official.
Are you obese? Is your BMI greater than 30?
Sorry.
You're overweight.
I have a BMI of 46.
Extreme obesity, formerly known as morbid obesity. Class 3.
No.
Metastatic obesity.
Have you been feeling morbid?
I've definitely been feeling morbid, and I've been eating morbidly as well. No, I have a BMI and not that high, but
probably overweight.
It's always been overweight for sure.
I have the appearance of a long-bodied alien, an Alpha Centaurian, and yet I'm considered
Zeta Reticulum.
And yet I'm considered overweight. But anyhow, that's
really.
I think I look up to body positive models like Ashley Graham.
Okay, but you also said you ate like 8 Twinkies every night, something ridiculous like that.
Yeah, I'm definitely caloric. But I think it's fair to say, even in our small sample here, that just about everyone is overweight or obese. It's a serious problem, and metabolic disorders such as type 2 diabetes are gateway diseases, and certainly remove quality life years off many of your patients. So this is a super important topic that I think is often sort of swept under the rug because it's a sensitive issue. So we're going to deal with it in an insensitive way and try to get over the PC bullshit, man. And hopefully we'll retain some of the treatment modalities for obesity. So why don't we start off with some definitions and maybe comment on the utility of those indices for defining obesity.
BMI, as we were discussing earlier, that's body mass index, calculated as weight in kilograms divided by height, which is in meters squared. And that will give you a ratio that you can use that will fall into a certain morbidly obese class. So some values to remember: if your BMI is under 18.5, that's considered underweight. Something that you should remember for eating disorders, as it's part of the DSM criteria, is the BMI. Normal range is 18.5 to 24.9. Then 25 to 29.9 is overweight. 30 to 34.9 is obesity class 1. 35 to 39.9 is class 2, and 40 and above, that's extreme obesity with an X.
Taking obesity to the extreme. And so these categories are relevant. I'm sure they've been sort of validated in terms of disease outcomes, but they're also relevant for your patients. when you consider aggressive interventions, and also in terms of insurance coverage, which is more relatable to our American listeners. But for example, things like bariatric surgery candidacy may be determined by obesity status. So locally, folks that are extremely obese may qualify without condition, whereas those in the class 2 range, that is greater than 35, may need a comorbidity such as diabetes. So as flawed as BMI may be, I'm not fat, I'm just big boned type of attitude, as flawed as this classification system may be, there are clinical implications, and it's used clinically as well.
Right. And I mean, a lot of the time when patients come in and they are classified as extreme obesity, a lot of the time they're actually bodybuilders, where they have so much mass that it sets them over the edge.
Most of the time, I would say. Yeah.
Most of the time, they're actually very active and very healthy individuals. As we mentioned before, type 2 diabetes, that's certainly a risk that you'll be watching out for. We're also going to be worried about coronary artery disease, as well as stroke, hypertension as well. Dyslipidemia is going to be common. We'll get into that, some of the LDL and HDL later. With our bones, we're worried about osteoarthritis, and then gallbladder disease, as well as non-alcoholic steatohepatitis. We'll be screening for that as well as a lower back pain from a lot of the weight that these individuals are carrying around. Congestive heart failure will be another complication we'll be watching out for. And a variety of cancers are also, one would be at higher risk of certain cancers if they are obese as well. So certainly a wild amount of potential medical complications with obesity as an independent factor.
Yeah. So suffice it to say that it's a gateway disease, and it's a huge problem, highly prevalent in North America. Roughly 20% of the population is obese, and an even greater percent, I think it's now tipped over 50%, are overweight adults. Perhaps that's no surprise. Unfortunately, there's some groups that are more afflicted than others, and that's a huge issue, particularly from let's say a metabolic perspective in terms of guidelines in food intake, that suggestions around daily carbohydrate intake, for example, 300 grams of carb being applicable to people of all ethnicities is probably inappropriate and doing harm. So bringing awareness to your practice, especially with minority groups, is important. The pediatric population, obesity is increasing among pediatrics as well. So, seeing diabetes even in 18-year-olds, it's quite astonishing. So this is a highly prevalent, sort of a taboo subject. And for that reason, we're afraid of talking about it and probably putting people at harm as a result. So that was sort of a discussion around epidemiology. Now, why don't we talk about what causes obesity? Dr. P, perhaps you could field this question. What do you think is the root cause of obesity?
Well, I think the root cause
what's the proximal cause of being fat?
Well, it's metabolic imbalance. Like, people eat most of the same diet by and large across the world, but some people just digest food very quickly and are very effective at assimilating energy, and others are fortunate and have much slower metabolism.
So I comment that highly speculative, politically correct answer is probably the way a lot of people look at it, and obviously there is some truth to that. Certainly, lots of variability in metabolic rates.